Welcome to Path Pulse. In this video, we're diving deep into one of the most important tests in diagnosing and monitoring diabetes, the HbA1c test. Whether you're an MBBS student, preparing for NEET PG, or just someone curious about what your lab reports mean, this is for you. What is HbA1c? Full form, hemoglobin A1c or glycated hemoglobin. The basic concept is that glucose attaches to hemoglobin in red blood cells over time. This test reflects the average blood glucose over 2 to 3 months. The chemistry behind it involves non-enzymatic glycation of the N-terminal valine of the beta chain of hemoglobin. Since the lifespan of a red blood cell is about 120 days, it makes HbA1c a long-term indicator. Plus, there's no need for fasting, making it a patient-friendly test. Why do we do the HbA1c test? Well, it's crucial for diagnosing type 2 diabetes mellitus. It also helps in monitoring long-term glycemic control in known diabetics. Plus, it's useful in predicting the risk of diabetic complications like retinopathy, nephropathy, and neuropathy, and it aids in tracking patient compliance. Let's talk about HbA1c reference ranges and their interpretation. An HbA1c percentage less than 5.7 is considered normal, with an approximate average glucose level of less than 117 milligrams per deciliter. If it's between 5.7 and 6.4, that's prediabetes, with an average glucose ranging from 117 to 137. A level greater than or equal to 6.5 indicates a diabetes diagnosis, with glucose levels greater than or equal to 137. For diabetics, the goal is usually to keep it less than 7%, although this can vary slightly by guidelines. According to ADA guidelines, there's a difference between diagnosis versus monitoring cutoffs, and it's important to remember the significance of repeat testing for a proper diagnosis. An increased HbA1c level indicates poor blood glucose control over time. Generally, an HbA1c of 6.5% or higher is used to diagnose diabetes. Higher HbA1c levels are often linked to higher risks of complications, such as cardiovascular disease, kidney damage, and nerve damage. The target HbA1c for most people with diabetes is less than 7%, though this can vary depending on individual health conditions. Poor diet, lack of exercise, insufficient insulin or medication adherence, stress, or illness can all contribute to increased HbA1c levels. A decreased HbA1c level typically indicates better blood sugar control. A value lower than the target range can indicate the risk of hypoglycemia, low blood sugar. While a lower HbA1c is generally considered a good sign for diabetes management, it can sometimes indicate overly aggressive treatment, which may lead to dangerous drops in blood sugar. Effective management with diet, exercise, medications, or insulin therapy. Possible risks of hypoglycemia if too much medication or insulin is used. Let's talk about the limitations of the HbA1c test. This test is not suitable in conditions that affect the lifespan of red blood cells, for example, hemolytic anemia, sickle cell disease, or even a recent blood transfusion. Additionally, iron deficiency anemia may falsely elevate HbA1c levels. It's important to note that HbA1c doesn't reflect short-term glucose spikes, so it cannot replace self-monitoring or fasting and postprandial glucose tests. Now, let's explore the biochemical methods for HbA1c estimation. First, we have HPLC or high-performance liquid chromatography, which is considered the gold standard. There are also immunoassays, enzymatic methods, and capillary electrophoresis. It's crucial to mention that standardization is done by the NGSP, and there is traceability to the IFCC. Mnemonics and exam pointers. Mnemonic for causes of falsely low HbA1c, HATs, hemolysis, anemia, hemolytic, transfusion, shortened RBC lifespan, NEET PG buzzwords, long-term glucose control, RBC-based measurement, ADA criteria. Summary and final tips. HbA1c equals gold standard for monitoring diabetes. Key part of diabetes diagnosis and management. Always consider clinical context and other parameters. for NEET PG and MBBs. Understand biochemical principle plus clinical implications. For general audience, know your target levels and what they mean. If this helped you understand HbA1c better, don't forget to like, share, and subscribe for more such concise and clear medical explainer videos. Drop your doubts or suggestions in the comments, and stay curious, stay learning.